heart is aching.
I need dental care because I have lost 3 teeth in the last year and a half. And it's very, very important that I get my teeth fixed.
Can you point to where your pain in your mouth is? Right there, that's the spot.
Meet Dorinda and her brother Dale. Dale has a developmental disability and is a client at the Macomb Oakland Regional Center in southeast Michigan.
It's not necessarily from the medication. He has periodontal disease, and so that was one of the reasons why he was seeing actually a specialist, and he had to go for gum surgery, but we were not in a position to continue making payments on that because it was so expensive.
A lot of our folks have gum disease, and it's real important that they get the care, the toothbrushing, the extra cleanings to keep the plaque and the gums from getting inflamed and becoming infected, because they have found in medical research that the plaque that builds up in the arteries of the heart, it's the same plaque that's on the teeth. And in the brain, it's the same, causes strokes. It's the same plaque. It impacts, and when you have an infection in your gums, it impacts your whole body.
The last time I took him to the dentist was well over a year ago.
In Michigan, Medicaid funding for adult dental care was cut in fiscal year 2004, leaving approximately 1.5 million adults with disabilities without basic preventative and restorative services. The only funding for adults is for limited exams and emergency care and for extractions.
Who could look at someone who has the kind of intellectual disability that I'm speaking of, who is in pain and really needs a filling, not an extraction, and who could look at that person and say, well, I'm sorry, it's not my problem. Good Lord. It's a basic part of our living, to have teeth and to have a mouth that works so you can digest your food properly.
We've had a gentleman that at 27 lose all of his teeth, and he's not a candidate to wear dentures. So he's toothless at 27. He'll be having to eat pureed food for the rest of his life.
People with intellectual and developmental disabilities like autism or physical disabilities like cerebral palsy can't always take care of their teeth on their own and may require more heavy cleaning than regular patients. Psychotropic and seizure medications can also cause problems to gum tissue, making the individual prone to gum disease and tooth loss.
People with developmental disabilities don't have any money. All they have is their SSI, and without their insurance, they have no money. They can't purchase dental care.
Although the Macomb Oakland Regional Center has developed Project Smile, an initiative that relies on volunteer dentists and fundraising to help with the dental needs of their clients, it is not enough to meet the needs of the more than 4,200 consumers receiving services through their organization. And what happens to adults with disabilities served by other organizations?
Well, I would say that people with disabilities should be treated with integrity and treated as human beings. And we have a right to health care, just as you do.
If the dental cuts, for example, stay, all those services, dental, chiropractic, and podiatry, dental being for us the most important because it serves the highest number of people, means that our folks will, they're going to suffer, not relatively suffer. This is absolute suffering.
All I can offer them is going in, getting an exam, getting an x-ray, and the tooth pulled. And if the tooth is a front tooth, it's kind of humiliating to be, with one tooth in the front, and that's all they can do for you.
Then more people will be dying of heart attacks just because they had untreated gum disease. More people will be dying of strokes just because they had untreated gum disease. More people will be dying of diabetic complications, kidney failure, just because they had untreated gum disease.
It's just like the immunizations annual physicals. We do those to prevent diseases. We should be doing those to prevent dental diseases with dental.
Excellent.
Have you ever seen an old person in pain, a kid in pain, a person that's physically or mentally challenged, in pain? How can you possibly deny coverage for that? This is the United States of America. Oral health care is primary care. That's my message on behalf of the Michigan Dental Association and our 5,500 member dentists.
They say an ounce of prevention is worth a pound of cure, something to consider when hard funding choices have to be made.
That life is still worthwhile if you just smile.